Hello, today we'll explain ventilation asynchronous, including their definition, how they are produced, and how they are classified. Each member of the group will describe different types of asynchronous in a clear and organized way. Number 1. Trigger delay. Trigger delay is a type of ventilation asynchronous where there is a delay between the patient's inspiration effort and delivery of airflow by the ventilation. It is usually produced below trigger sensitivity or patient musculus weakness. It is classified as a triggering asynchrony. Number 2. Ineffective trigger. Ineffective trigger is a condition where the patient makes an inspiration effort but is don't activate the ventilator. It is commonly caused by out-of-beat or low-sensitive settings. It is classified as a triggering asynchrony.
Trigger delay. Trigger delay occurs when there is a long time gap between the parent's inspiratory effort and the beginning of the mechanical inspiratory cycle. It is produced by exercise sensitivity, thresholds, or increased work of the thing. It is classified as triggering and astronic and can be detected by observing the ventilator weapon front while palpating the patient's upper abdomen.
Now we will talk about two important types of patient ventilator asynchronous, flow asynchron, and double triggering. First, I will talk about flow asynchronous. Flow asynchronous occurs during the delivery phase of mechanical ventilation when the ventilator does not provide enough flow to meet the patient's inspiratory demand. It can happen in volume control ventilation when the set flow is insufficient, or in pressure superventilation when the right time is too slow and causes insufficient restoration. In this situation, the patient tries to inhale more air than the ventilator is delivering, which causes discomfort and increases the work of breathing. This condition is classified as a flow asynchronous. Note I will explain double triggering. Double triggering is a type of triggering asynchronous. It happens when two consecutive breaths occur with light or no expiration between them. This occurs because the patient's neural inspiratory time is longer than the inspiratory time set on the ventilator. As a result, the patient continues making an inspiratory effort after the first breath, which immediately triggers the second breath. Double triggering is one of the most common asynchronous after ineffective efforts.
Premature cycling. Premature cyclings occur when the ventilator ends the inspiration phase before the patient has finished their own neural inspirations. It is classified as a minor cycling asynchronics, also referred to as anticipated cycling. It is caused by inspiration time C2 source out the high cycle off, threshold high in inspirational support mode, the patient perceives and is interrupted breath. The line of cycling. The line of also called prolonged cycling is when ventilator continues delivering the breath after the patient has already finished the neural inspiration. This can be inspiration times too long of cycling of test hall see too long in pressural support ventilations. The patient might activate contracting the expiration muscle to fight the ventilator with increase the work in breath static. Breath static occurs when a second breath is delivered before the previous ones as being full exhale, causing progressive volume accumulation in the lungs. It is close relations to the dual tiger and the latent cycling. It is can worsen lung injury and to excessive tidal volumes. It is considered a mix of secondary and sequence.
Hello, my name is Kevin Mejia. Reverse triggering. Reverse triggering develops during controlled modes of mechanical ventilation. It occurs when the ventilator initiates a breath that then triggers a reflex inspiratory effort from the patient's diaphragm, the opposite of normal triggering. Over-assistance can lead to reverse triggering, which can also worsen lung injury. It is classified as complex triggering, asynchrony, and it particularly difficult to detect because patients are often sedated when it occurs. Conclusion. Patent ventilator. Asynchrony is one of the largest challenges in mechanical ventilation and is associated with prolonged usage state and increased mortality. B. Analyzing volume flow and pressure waveform on the ventilator display. Clinical can detect the most common types of asynchrony. Recursing and corrective test asynchronous is essential to improve patients' comfort and outcomes. Thank you.